Children grow rapidly in size, strength, and mobility. Their language and cognitive skills develop quickly throughout infancy and childhood. This can make giving medication to children particularly challenging. Some things you can do to make giving medication to children easier is to always act confidently and let the child know you expect her to cooperate. After giving the medication, thank the child. Remember, what works for one child may not always work for another, so be flexible. Talk to the parents about how they get their child to take the medication and try to follow the same routine when possible. In this section of the training, we'll discuss each developmental stage and the techniques you can use when giving medication to all children, including those who are ill or uncooperative. Infants are just beginning to build trust. A baby's ability to trust an adult grows through everyday interactions. When an infant is fed, comforted, or attended to when she cries, she learns to trust the adult who provides this care. When giving medication to infants, make them as comfortable as possible. Hold and rock the infant before and after giving medication, and talk to the child in a calm, soothing voice. Also, remember to give the medication before feeding, unless the healthcare provider's instructions specifically state not to. Sometimes young babies will suck medication through a nipple, but never add medication to formula or breast milk. You won't be able to assure the infant has received the complete dose. In fact, the baby may refuse the feeding because of the different taste. It's important not to force a crying baby to swallow any medication. Toddlers are developing fierce independence. They often test limits and see how far they can push you. Being able to count on certain outcomes is important for a toddler's sense of where he fits in the world. Keeping a routine and being consistent are components of working happily with toddlers. Here are some techniques that work well with this age group. Give the toddler some control. Gently explain that what you're doing will help him feel better. And using a stuffed animal or doll to show the toddler how you will give the medication. Also, soothe the child before and after giving the medication, and ask parents what techniques they use at home. When giving medication to a toddler, it often helps to give him some type of choice. However, limit that choice to the color of the cup or the stuffed animal that you use for practice.
Did it. Now you try.
Never ask a child of this age if he wants to take the medication. The answer is almost sure to be no. If you get a no response and then give the medication anyway, it will become a battle of wills and future medication doses will be that much more difficult to give. By following these techniques, you can ensure that the toddler's independence and trust in you are not compromised when you give the medication. Preschoolers are developing social skills and initiative. These children can understand explanations, but learn best from concrete experiences. Preschoolers want to make choices and feel important. Here are some techniques for successfully giving medication to preschoolers. Gently explain what you are doing. Let him know what he can do to help. Have the child think about what he wants to do after taking the medication. Give him as much choice as possible. School-age children have no trouble expressing their own ideas. They may begin to compare themselves to their peers, so they may not want to appear different. They long to fit into a group and feel nurtured by both their peers and the adults around them. Here are some techniques that work well with school-age children. Give as much control as possible, and allow the child to express her feelings about taking the medication. It also helps to involve the child in the medication taking process. But what happens when your best efforts fail and the child refuses to take the medication or you can't give it safely? Never yell at, threaten, or restrain a child in any way, and never force a crying child to take medication. If a child won't cooperate, call the child's parents and let her know that you cannot give the medication safely. You'll need to write this down as a missed dose in the section on the back of the log of medication administration. Also, refer to your program's approved healthcare plan for any additional actions you must take. If a child spits up or vomits after getting the medication, don't give the dose again. Let the parent know what happened and write it down. If a child is absent or not scheduled to be at the program, this doesn't count as a missed dose because you were not responsible to give the medication to the child. And if you run out of medication and the parent hasn't given you more, write down in the child's log the reason why you did not give it, and ask the parents if they want to discontinue the medication. Remember, there is a section on the back of the written medication consent form where the parent can discontinue the medication earlier than what is written by the healthcare provider. Your own understanding of the children in your care is the most powerful tool you have. You know their moods, likes, and dislikes. The trust of a child is a fragile thing. Do not abuse it by lying. Never tell any child that the medication is candy, and don't let giving medication become a battle of wills.